안녕하십니까.
Hello, I am Dr. Chun Se-young. I'm with the Digital Hub Dental Office. This is the fourth Digital Dentistry lecture. Today, I'm going to talk about the fully guided implant planning using Implant Studio software. In the second lecture, we talked about the fully guided implant. Let's review what the fully guided implant is. Briefly, 3D digital implant, the characteristics of that. The first one is using the 3D simulation is done. Three-dimensional simulation. Conventionally, implants were placed first. Opposing teeth, adjacent teeth, handicap, soft tissue, and bone are considered. In the simulation, actual teeth forms are determined first. After that, implant positions are determined. Secondly, CT and intraoral scan images are merged. Three-dimensional anatomic structure of patient is represented in the virtual world on the monitor. The full guided implant surgery, as I said earlier, the precise guide is used during surgery. That is the characteristics of that. Before implant surgery, prefabricated prosthesis can be delivered right after the surgery. Let's look at the pre-op workflow of a 3D digital implant. First, in order to do 3D digital implant surgery using CBCT, three-dimensional anatomic structure needs to be acquired using intraoral scanner as well. Surgery simulation, planning software, or prosthesis design software is used to simulate implant coordinates. Based on that, prosthesis is designed. After that, based on the implant coordinates, surgical guide, abutment, crown would be fabricated using a 3D printer or CNC milling machine. Guide, abutments, or crowns are prepared before surgery. So in this lecture, we are going to talk about how to implant coordinates are programmed and simulated. Simulation process, the software will be introduced, but before that, let me introduce scanners softwares of 3 shape. Briefly, Trios 3 is written here. Right now, Trios 4, a very good scanner, is provided to you through Austin. Trios 4 provides wonderful scan data. That's a very good scanner. And this 3 shape provides not only scanner, implant abutment fabrication, denture, or many other prostheses can be designed using the Dental Manager. That's a CAD software for prosthesis. Setting up ortho appliance like a bracket, transparent appliance, indirect bonding, or model can be analyzed by the ortho software, which is Ortho Analyzer and Planner. And implant simulation can be done with the Implant Studio, as you can see here. That's a very wonderful software. The full lineup software, the full digital dentistry leading company is the 3 shape. 3D digital implant full guided implant. Merging technology is the key for that. So let's review merging. 3D data is utilized. Head, mouth, and skull of a patient. All the soft tissue and hard tissue data are merged together. Tooth and bone. Three-dimensional data can be acquired. Scan data for gingiva and teeth can be acquired. If those two images can be merged accurately, actual patient's anatomic structure can be utilized in our simulation. CT and intraoral scan data need reference points to be merged. That's the teeth. So using the teeth, they are merged to produce patient's anatomic situation to be used in the virtual world. So merging is the most important thing. Implant simulation software is used to do the design in this video. Number 26 and 27, implants and crowns will be designed. To do the work, an order sheet is prepared, as you can see on the top of left. Maxillary intraoral scan data and the mandibular intraoral scan data and CT data are uploaded to the software. Top-down planning, as I explained it before. Prior to implant positioning, the definitive prosthesis is simulated in advance and positioned. It is a time-consuming and cumbersome process. A top-down approach is used to design crown first, and considering the relation with the soft tissue and adjacent teeth, the fixtures coordinates are determined. After such a simulation is done, guided surgery is performed. At the time of fabricating the final prosthesis, the errors or dilemma that can face the dentist can be resolved in advance. The crown design cannot be made very precisely, but in terms of function or considering the adjacent teeth and the adjacent anatomic structures, the selection can be made in advance to determine the coordinates of the implants. As I said before, from surgery to prosthesis stages, everything will go smoothly and naturally. If you look at this image, the crowns are positioned to a certain degree for the occlusion of the functional cusp and the central groove of the opposing teeth, teeth axis, torque, or tipping are adjusted in advance. Then, after checking the form, direction, position, or mechanical characteristics of crown, the coordinates of fixtures are determined. So in my case, almost 100% of the surgery, implant surgeries are done with the guided surgery. So stress is greatly relieved from surgery to prosthesis. Therefore, I can enjoy the clinical activity. If you look at here, they are matching with the forms of the teeth very well. The next stage, the CT data go through the cropping process. The amount of CT data is voluminous. To reduce the visible CT data, and unnecessary CT data would interfere with the designing work. So the hard tissue or soft tissue data of opposing teeth or adjacent structure need to be trimmed in advance. Then the simulation work will become much more comfortable, accurate, and very precise simulation can be achieved. Therefore, all unnecessary data would be eliminated in this process. Now, this stage is to set panorama curve or occlusion plane. If the plane is set properly, when you see the panoramic view at the lower bottom or occlusal arch, as the anchor points are clear, plain, you can view the simulation quite easily. Now, CT data is being merged with the intraoral scan data. Just a couple of years ago, merging could be performed with the 3 points manually selected. Now, in the Implant Studio, automatically the merging is performed. It is very precise and manual adjustment is not necessary. That much the merging is accurate. Whether merging is properly done or not, centering on the number 10 teeth from many different perspectives, matching of soft tissue and intraoral data need to be checked. For implant surgery simulation, this checking should be done thoroughly. If this goes wrong, when implants are placed in a patient, the implant placement positions would go wrong. The yellow line is a scan data, and this is similar to soft tissue or CT data. However, the teeth may be a little bit different because teeth have light reflection on oral scan data, and CT has burning phenomenon. But if the difference is the same between the left and right, accurate matching is achieved. Make sure to check the matching at bilateral, posterior, and anterior regions before you move on to the next stage. Now, all the merging, all data entry is completed. Now, actual implant coordinates need to be decided. At what positions, at what angle implants need to be placed. That is the decision we have to make. Now, number 27, implant is selected and coordinates are entered. The positions of teeth, axis of teeth, bone, central line of teeth, skeleton are considered to come up with the coordinates. Here, up to final prosthesis or gingival adjacent bone, sinus, mandibular nerve, and vulnerable structures are considered to determine the implant positions. That means you can decide for a certain type of prosthesis where implant positions should be. So another convenient function, if you want to place multiple implants together, they can be grouped together. And if you move one of the implants, the whole group moves together. So if they are to be placed in parallel and the prosthesis in parallel, this grouping function is very simple and convenient, reducing errors. I actually put a lot of efforts in this stage at the implant positions that I decided. Actually, when abutments or crowns are to be fabricated, I make sure there's no problem with the gingiva or adjacent tissue. For accurate fabrication of prosthesis, I take various measurements to make sure there is no problem with the prosthesis when they are fabricated accurately. Through the verification process, if necessary, we can make some adjustments to the positioning of the fixtures. Then we will have satisfactory outcome in terms of aesthetic implant, aesthetic abutments, aesthetic gingiva tissue, and aesthetic crowns. So through the verification process, I do the final simulation and verification for the prosthesis and implant fixture positions. Each implant can be rotated 360 degrees. For these teeth, the depth to the lowest floor of sinus is measured. So in the sinus, I decided in this case to do bone grafting and GBR together. Therefore, the very important decisive factor is the height of the top of the fixture. If you do not do the implant simulation for the guided surgery, and if you just rely on your visual checking, I don't believe you will be able to place the implants as planned, like with this precision. Therefore, the important factors like the height of the top of the fixtures should be able to be reproduced during the surgery as it was simulated. That is the biggest advantage of using this. That is the power of the guided surgery. So as I decided the design with the precision as planned, the outcome can be reproduced in a patient through the implant clinical treatment. So as I said before, since 5 years ago, I do the guided surgery for almost all surgeries. Just a couple of surgeries a year, I do not use it, but more than 90% of the surgeries are done with the guided surgery. Now we're almost done with the positioning of the fixtures. Now we need to design the guide. When it comes to the guide, determining the path is very important. The fitting of a guide will be determined by the path. It can be mounted tightly or loosely. So when you determine the path, you need to consider the implant positioning in the teeth to be covered by the guide, and the path should be where the undercut is the least. Next, the borderline of the guide is drawn by me by putting points. So when you do the drawing, the guide's limitation points are made. For this 2627 free end case, the guide is made of resin. So during surgery, if you apply pressure on it, it can bend. Therefore, at number 7, in the distal side, the guide borders should be extended toward number 7 distally a little bit more, then the bending can be prevented. So in the free end case, when you get the intraoral scan data, you need to try to get the scan data a little bit more posterior to the fixture positions. And another important data, there are various information. The thickness of a guide, and if you look at here, the offset of teeth, the border between the guide and the teeth, all these will be denoted in numbers. Depending on the precision level of the 3D printer that you have, you need to decide on the values considering those things. Then you will be able to use a very precise guide. Now the bar is generated. In the sleeve hole portion, resin is very thin and you need to reinforce it to make it rigid to prevent fracture or bending. So bar is added to enforce that. Now the bar is made. After that, a window is added. So let me show you how the windows can be added. The window, actually, one more bar is added. The guide is pretty long, so there's a risk of bending and fracture. To make it more rigid and stable, a bar is made. Now the guide is a half jaw size, but if it is a full size guide, trans-arch guide, then palatal bar needs to be added to make both sides more solid to make the guide not bent or fractured during surgery. Now, a window is created. The role of the window, when a guide is delivered to the mouth of a patient, whether the guide is accurately mounted or not, needs to be checked using this window. If the guide is eliminated in that portion, whether the guide is tightly contacting the teeth or not can be visible. So whether the guide is tightly contacting the teeth can be verified using the window. Next, in most cases, I put one window right in front of the sleeve hole, and like this, in the middle of the entire guide, another window is created. This is to check if the most posterior and the second most posterior teeth portion and the center tooth portion of a guide are tightly set. Only when those three portions are accurately and tightly set with the teeth, there will be no errors when the fixtures designed in the implant studio are reproduced in a patient. They can be placed in a patient. If it is not tightly set and if you do the surgery, totally different locations, the implants will be placed in a very different places than we designed. Therefore, this is a very important structure when it comes to the guide to prevent such failure. Now the guide is completed. Next, it is to be approved, and the guide will be saved. The file can be printed or sent to a milling machine to fabricate a guide. Here, let me talk one more thing about the 3-shape solution. DCM file is the scan data, a video type color scan data, and STL file is also supported. In the implant studio, CT and intraoral scan data are merged. To the merged file, the fixture coordinates are added. That is called a 3SZ file or a 3OS file with number 3 in the file name. Such files are supported. However, other companies do not support the files properly. At the implant studio, fixture coordinates are added to the CT data and intraoral scan data. They are added together, and after that, they are moved to the prosthesis software. Using the coordinates, the prosthesis can be fabricated. If those 3 files cannot be used together, after implants are placed, the scan body or pickup impression should be taken again with the impression coping, which is cumbersome. If you use the coordinates, prosthesis can be fabricated without that step. 3Shape is the first company to provide such software and the format. So I prepared this slide to introduce that function. As I said before, the coordinates are made in the implant studio, 3OZ file with implant coordinates. is transferred to the prosthesis designing software to design abutments and crowns, and the STL file is sent to a CNC milling machine or a 3D printer. So before surgery, a guide prosthesis abutments are fabricated using this solution. Among many implant planning software, I use the Implant Studio the most because of these advantages. Now, a Q&A session. Let's look at the questions. Do you do the designing with the software yourself? Yes. I do the software design with my colleague dentists who work with me, because as for handling the software, lab technicians, dentists can try several times and learn themselves or get a training. However, the most important thing is that when you handle the software like Implant Studio, that is important to determine the implant coordinates to make a patient case more complete. That is a very important process, and there are so many factors to be considered. Therefore, software, especially the Implant Studio, it needs to be used in determining the implant positions. I believe dentists yourselves need to do it yourself. In other words, implant surgery should be conducted by dentists. It's not because we are a doctor or a dentist. In order to place implants, we had to learn a lot, accumulate knowledge, and had to take various tests. There are so many things to consider, and what we decided on the simulation can be reproduced as they are in a patient. Therefore, the pre-surgery simulation is just like the actual surgery. That's the significance of that. Therefore, software designing should be done by a dentist. I want to emphasize this one more time. The second question, after the fully guided implant design, fabricating a guide isn't it too cumbersome? Yes. Those who have a lot of implant practice, without a guide, they can manage to place implants without a lot of difficulties. I was also the case. For more than 10 years, I placed the implants without a guide. However, after I began to use fully guided implant surgery, one thing has become different. For definitive prosthesis, in the past, when I did not use the guided surgery, I encountered some difficulties from time to time. But with the guided surgery, if I don't overlook some important factors during the simulation, after the surgery, all the cumbersome difficulties disappeared using the guided surgery. Fixture coordinates are determined considering the prosthesis and the relation with the gingiva and all other factors. Therefore, when definitive prosthesis is completed, the fabrication goes very smoothly and easily, and the outcome of the prosthesis is very satisfactory. With the guided surgery, a lot of stress that I felt disappeared. It can be done easily, not only me, but the staff, our staff also felt the same way. And the stress felt by the patient is also reduced. Design work and fabricating a guide is time consuming and requires some work, but in terms of the total process, the guide design and direct printing actually reduces the time taken for overall process. And the stress is relieved as well. There's some efforts that needs to be exerted, but the outcome of the clinical practice is more satisfactory. So this has been the fourth lecture of digital dentistry. In the fifth lecture, I will come back to another lecture of digital dentistry with the Dental TV. Thank you.
인사드리겠습니다. 감사합니다.